In Abuja, mental health advocates are asking President Muhammadu Buhari to assent to the National Mental Health Bill passed by the National Assembly in November 2022 before expiration of the 90-day deadline. Health correspondent Kemi Balogun has details.
The National Mental Health Bill has been passed by the National Assembly, and the next stop is for consideration and an assent from President Muhammadu Buhari. It is now crunch time as advocates are pushing to get the word out as they wait for the president to sign or withhold his assent before February the 26th, 2023. There has been no form of legislation or mental health reforms in the country for decades, and advocates have gone through a great deal to ensure that it comes this far. With an election upon the nation, it is becoming increasingly urgent to get this done, and advocates are hoping this will happen soon.
This has been a struggle that's really been going on for 2 decades. It started in 2003. There was a national mental health bill introduced. In 2009, it was taken away. In 2013, it was introduced again. And then it also failed in the legislature. And so in 2019, the journey started again. We weren't, everybody was wondering, is this going to be third time a charm, or is it going to be, strike out again? And this time it was a charm.
The National Mental Health Bill seeks to basically provide more support and care for persons dealing with mental health issues. The bill seeks to guarantee that those receiving treatments have the right to participate in the formulation of their medical plans. Angela runs a non-profit organization which started group therapy sessions called Unburden. With the help of a certified psychologist, participants take turns in sharing their feelings about issues that affect them.
Anything in relation to mental health is really not taken, seriously. So we thought, okay, how can JDI come up with this unburden group therapy session, make it free, affordable? Yes, it was once in a month for the public to come into a safe space and have access to an expert that they can unburden, to. And we've seen quite a number of improvements, and also with the people that have consistently come in.
Are you showing my screen?
For Angela, Chime, and thousands of other advocates, this bill, when signed into law, will be a start to a great beginning for mental health care for all Nigerians.
This is going to do a couple of things to really help individuals. The first thing is it creates some new structures. It creates a mental health fund. It creates a mental health assessment committee. It creates a department of mental health services to make sure the provisions of the bill are established. It guarantees important human rights, whether it's the right against discrimination in housing or employment or medical services, the right for mental health individuals or people who have a condition to partake in their treatment. One of the things I think is most importantly is that it allows for treatment to go to the community level.
Part of our volunteers that take that step as well to say, let me be the first person to tell you my own mental health challenge and what I've been through before. We have people who have probably even attempted suicide before and were able to talk about it in that space. And because of that, there was that connection with others that came into the safe space. Part of the bill as well talks about the Ministry of Health, I believe, ensuring that they engage people with lived experiences to be support staff within maybe the centers. And I completely believe so much in that, because when someone is able to say, hey, this is what happened to me and this is how I found help and this is how I'm coming out of it, others can also say, yes, I'm not isolated in my problem, but I can also find help as well with you.
About 40 civil society organizations are partaking in efforts to pile pressure on the president to assent to the bill. And in the coming weeks, a lot more advocates will be at the forefront of discussions. Kemi Balogun, TVC News, Abuja.